So every minute, 7 people around the world have a replacement of knee. That means that today we're going to introduce or focus on why this number is important for a specific design of the implant. Today we're going to talk about the anatomy of the knee. Also, we're going to talk about biomechanical functions, and also the clinical results or outcomes. So especially, or first of all, we want to dedicate this presentation to Anthony Gray and Daniel Sarr, which have already given us this prosthetic. And we want you to take a moment to look at it if you want. So this is a femur implant. So to start here is why the knee is so important. So we have here the most stressed and underestimated joint, which means that this is the joint that receives more weight on the body. Not only it's the more complicated, but it's the more functional. So let's go to the next. Yeah. So the type of joints. So we have three types of joints. We have the synovial joints, which are the knee, the hip, the ankle, and shoulder and knee. We have the fibrous joints that do not have movement, and we also have the cartilage joints. So these are, let's say, middle movement. Next. So here we have the synovial joint, which is actually the knee. So we have four components of the joint. Thank you. of this synovial joint. The first is the articular cartilage, which is the part that reduces the friction in the joint. Then we have the synovial fluid, which is the lubrication of the joint, and also reduces the shock or absorbs the shock. Then we have the joint capsule, which is the one that keeps the pressure in the joint. And then we have the ligaments, which are the ones who prevent the joint to move backwards, forward, or to the sides. So here specifically, we want to talk about the four main bones that compose the knee. So the first is the femur. The femur is the one that is connected from our hip to the knee. So in this case, the femur implant that we are that you are touching is especially this part is the condyles of the femur. So then we have the tibia, which is the one that receives the more weight of the body. Not only connects with the tibia, it's with the femur and patella, but also receives all the weight. Then we have the fibula. The fibula is not directly a part of the knee, but it helps anchors all the way. And finally, we have the patella, which is the circle bone that we have here, which prevents the excessive motion. So here we have the other components of the knee. We have the cartilage and the menisci. So as you may know, most soccer players suffer menisci tear, which means that it receives also the weight, but also helps to load or to distribute the loads in the body.
Balance?
Yeah, balance. Thank you. So here we have. This is the next.
Yeah.
So here we have the lubrication. So the synovial joint has this lubrication that has hyaluronic and lubricant liquids that help lubricate the joint, so we have like a natural cycle movement. And yeah, that will be from my side.
We are going to present physical properties. The titanium has a density of about 4.5 grams per cubic centimeter. This show the metal compatibility with the bone, and the melting point is 1668 degrees Celsius. That we have two crystalline structures. The first one is a hexagonal closed packet, that we see in room temperature, or in higher temperatures we see body center cubic. Mechanical properties, the pure titanium and titanium alloys have a Young's modulus, certainly to 110 gigapascals, compared to the stainless steel and chromium alloys. This is important to reduce stress shielding, and this is important, which is critical for implants that experience cyclic loops, and like hip and knee prosthesis. The titanium, puedes pasar por favor. Bueno, based on physical properties and Young modulus, titanium is now known for its use in knee and hip prosthesis. These implants is exposed to friction, compress, and shield forces, and flexion, extension, external, and internal rotation. That these movements are produce wear and molecules that may lead to prosthesis damage.
Okay, before starting the chemical and biological comparison, I'm going to mention some concepts that are very important when we are talking about implants procedures. So the first is corrosion, that is a chemical degradation or wear of a metal, any metal, that leads to ion release into our biological fluids. Then it's the ion release, that is the migration of those metals from the implant into the surrounding tissues or, well, synovial fluid. There's the cytotoxicity, that is the ability of those ions to damage cells. This reduces viability, or even can trigger inflammation. There's also the cellular secretion, that it's the response of those damaged cells by releasing cytokines, enzymes, or reactive molecules. And finally, there's the also integration, that is the direct structural and functional connection between the living bone, in this case the knee bone, with the titanium or the metal that it could be used in an implant. So, well, as we can see, these all concepts are related, because if there's a corrosion, then it leads to an ion release, And this can be present with cytotoxicity or cellular secretion, and these all together at the end affect the quality of the osseointegration. So, well, septics. Here there's a comparison between the titanium and the knee bone directly. So basically, in terms of corrosion, as the bone doesn't corrode because it's a biological tissue, the titanium has a very low level of corrosion, so we can say that it's safe for our body. Then the same, the ion release, it's the same. The bone, it's not a metal, but a biological tissue. So apart from normal cases, or if the bone is healthy, its normal physiological values, we wouldn't find an ion release. But in the titanium, in the case of the titanium, is just a minimal ion release because it's low corrosion. And the cytotoxicity, well, both are safe. Titanium it's one of the highest, it's the metal with the highest biocompatibility. It has a greater than 95% of cell viability. With the cellular secretion, well, here we talk about inflammation that could be present in our body. So both the same, produce minimal inflammation. Those three, TNF alpha, IL-1 beta, and IL-6, they are molecules of our immune system, and they are the ones that trigger and control the inflammation when necessary. And the osseointegration, well, bone, its total function is 100%, and bone titanium, it has also one of the highest values for a biomaterial. It has between 70 to 80% of biocompatibility. And okay, finally, in terms of chemical and biological comparisons, here's a table. Here's a table with the values of the titanium versus stainless steel versus cobalt chromium compared to the bone, in this case, well, the knee bone. So basically, as you can see, the values in each column are related with the corrosion, with the ion release, with the cytotoxicity, and the cellular secretion, and at last the osseointegration. And compared to the knee bone, the closest values are those that belong to the titanium. So that's why it's the most biocompatible metal among metals.
All right. Now, to prove that a titanium knee implant is safe and works well inside the body, several biocompatibility tests are performed. Here we have the in vitro tests, which are laboratory tests with cells. Then we have in vivo with animal models, and then clinical, which is directly in patients. First, we are going to start with the in vitro test with cytotoxicity. Here is measured whether the cells are active and alive or whether the cells are damaged. For this, we got this study of a 3D printed titanium alloy 6-4 where a live death fluorescence staining was used. In this study, light cells are stained, or well, light cells appear in color green, and dead cells appear in color red. As you can see, the vast majority are green, confirming a high cell viability and the absence of significant toxicity. Now we got the adhesion and proliferation from the same study, where the titanium alloy scaffolds were modified with sodium hydroxide and dope. Sodium hydroxide, yes. Well, in the graphic, you can see here, the control is used as the reference, where it is, well, it's used as the reference as 100% of adhesion. With DOPA and sodium hydroxide alone, the adhesion decreases. But while these both are combined, the adhesion increases slightly. This is because the sodium hydroxide activates the surface and allows that DOPA binds more effectively, which also allows that the osteoblast find sites more favorable to adhesion. Now, wait. Regarding to the asterisk, you can see here, this means statistical significance. One asterisk means that the difference is significant, while two asterisks means that a highly significant difference, which is even more reliable. And this proves that the use of chemical treatments improve the osseointegration. Next, please. Now, with the inflammation control, we here use other study where shows that the same alloy, the titanium alloy 6,4, show a minimal inflammatory response with low levels of cytokines, such as IL-6 and TNF-alpha, proving that the titanium doesn't overactivate the immune system. Now, with the tissue engineer and osteoconductivity, we return to the last study with the 3D titanium scaffolds, where it is shown in this image that the interconnect pore network promotes cell growth, vascularization, and integration with natural bone. Next, please. Now we also want to mention the mechanical test. In this, the mechanical tests are performed in concordance with the ISO standards, such as ISO 14243, to evaluate wear, particle release, and kinematics in knee simulators. In this study, here we can see a finite element model, where the femoral component is in green, the tibial insert is in beige. And, well, these simulations allow us to apply real forces such as flexion, axial compression, anterior-posterior displacement in anatomical geometrics. Next, please. Now, well, next come the animal testing. Here we got another study with the same alloy, titanium alloy 6,4. Here it was implied in mice, a disc in a subcutaneous pocket in the dorsal skin. And well, this study shows minimal inflammation and non-necrosis, demonstrating excellent immunological tolerance. As you can see in this image, the image A shows the skin in contact with the titanium, and the B shows the skin, the normal tissue. Here it was used trichrome, to which stain the collage in green, to show, to evaluate fibrosis and scarring. As you can see here, there is no critical difference between this image with the control, showing that this is, that the titanium is biocompatible. Next. The last animal study were performed in New Zealand white rabbits, where they implant the same alloy titanium in, but this time in the proximal tibia. And then they inoculate a MRSA to induce prosthetic infection. These were the implants they used in the rabbits. The objective was to evaluate the progression of the infection and to see how responds the treatment, which was with vancomycin. One second. Which was vancomycin. And that is for my part. The clinical results. This confirms all that we talked about before in the in vitro and the in vivo test. It shows the survival rates of these implants in different studies. Here we have a similar system with titanium coatics, which show a 90% of survival rate at almost 70 years. Then we got a highly porous tibial traits that, like we talked about before, improves the osseointegration, the pores. That got a almost 98% of survival after 10 years. And finally, nutritive prosthesis for people with allergies to metals. Shows a survival of 10 years, a survival rate of 10 years. Thanks. That's for my part.
The finish of the niche. Today I wanna highlight how much in the process how improve. The process lasts up to the 30 years. Depending the patients, advanced technology and surface bioactivity, imaging 3D, and the perfect individual anatomy, improve and comfort, reduce postpartum complications.
Okay, in conclusion, we can see that the titanium has many different aspects or many different attributes that help us not only design but also implant the titanium in the knee, especially the knee because it's our part that we are talking about, but in all over the body. Also, we have that the biocompatibility and the chemical and biological aspects are very similar to the body, so it means it helps the osseointegration and help us reduce any risk while the patient is in the surgery. So that will be all for our side. Thank you so much. I know it was so long, but thank you for everything.